And who do you think would be benefit from sideline massage?
Pregnant woman.
Pregnant woman?
Back problems, can't lie.
Great, great. Back problem.
Respiratory.
Back problem, if you put them facing down, it's quite dangerous because they can stuck there.
Yeah.
Who else?
Respiratory problem.
People with respiratory problem, elderly,
Hip problems.
hip problem. If you have one side hip problem, you can work on this side.
Broken bone of any kind,
Yeah.
bruising arm, leg, bruising down one leg.
They have bruise. If they have a problem in one side of the body more than the other, and you want to concentrate on that, that would work. And whoever likes to sleep on the side, which is most of us. Who wants to sleep? Who likes to sleep on the side? Yeah. So it does make a lot of sense that that considered to be a comfortable position for most of us. So I would really, really encourage you to work sideline. Yeah? And even in the exam, oh no, it's not that far, but practice with it and try to do that. Yeah? Sideline is a great position. So we have this opportunity, but with it, we have some problem. And I'll tell you why. Can you come a bit closer? Yeah? Can you straighten your legs a little bit? Good? Right. There is an inherited instability for sideline. If I start now doing massage in here, do you see what's the problem? Client is not comfortable. How can I help it?
Position.
Sorry?
One leg over the other.
Either one leg or the other, or two legs together, and then you put teddy bear, yeah, in between. So it will keep, especially with female, that the hip is quite wider, it will keep the leg parallel to one another, and that would be a lot more stable, yeah? You still need to use your hand sometimes to help with stability, yeah? Thank you. Let's talk about draping. Draping would be quite similar. You will have the tea towel, yeah? So longer towel on the top part of the body, shorter towel on the lower part of the body. You would lift it, you will tuck this under. Sorry. You tuck this under, and then you're ready. Be sure that everything is quite comfortable. Ask them now to take the upper hand outside, and then if you can tuck the lower part underneath your body. Yeah? Good. So they feel quite stable. Now when you need to massage, if you do the shoulders, then you're having a quite good access to it. If you're doing the back, all you can do is just, fold this top towel and you have the back there ready. We'll talk about the lower part of the body in another session, so you have time to practice, and then we'll do that. Okay? Good. So let's look at the neck, shoulder, and upper back complex, okay, or region. Yeah, I would say we have three positions that we can work on. I can work on facing the client, I can work from above, and I can do some technique, and then I can work from the back part of the client, from here. So I would like you to think about approaches rather than technique, because it's more mature way of being a therapist, rather than to say, okay, the therapist is this technique. Put yourself in a certain position, and then say what my hands could do in this position, and then you find yourself quite frankly doing it. Okay? Okay. Have we talked about the pillow and the position of the head? Never? Okay. Could you maybe come a little bit more this way? And I want you to look at the range, the position of the spine and the neck. Does it make sense that the neck would be just continuous with the neck?
Mm-hmm.
Yeah, okay. Let's take that and then drop it. Is it good?
No.
Not very good. Okay. Good. Let's See that? Is it enough? Probably not. It is subjective, but do try to find a position that will be more or like leveled.
You wanted to keep it aligned.
Yes.
So
There
this
is-
is not perfect.
It's a little bit too high. You know what I do in my clinic? I have lots of folded towels because sometimes having two pillows is too much, one pillow is too little, so I correct it a little bit. Yeah. There is another problem with the head that is quite floppy, is where to put the head onto the pillow. And I want you maybe to come now more to this side, yeah, more to here, above. Yeah. Your head, good. Put it. What happened is that now the head has tendency to fall forward. Yeah, I wouldn't say that problem, but I would say I see therapists doing this way. So what happened every time you are moving the head roll forward. So be aware to actually put the head, if anything, a little bit backward, so it's quite stable. Okay, good. Let's now start. Have we done with mobilization? Yeah. Before massaging, you can actually, or using oil, you can do quite nice mobilization. You can start mobilization with facing the client, okay? You're putting your hand underneath, and you just be sure that the client's head is quite floppy. You put your hands on the top of the trapezius. Now let's talk about our body position. You can use your head, your legs parallel, but I would say that for me it will be a little bit more comfortable in this position. And now what I would like to do is just roll the shoulder and then do the opposite side. So there is almost like opposite side pressure. The lower hand press up, the upper hand press down, so the client can feel really secure. Or I find this position also quite easy. Good. So this would be one mobilization. Another mobilization you can do from above. So you can bring the arm and stabilize it here. And then you can have your hands, you know where the teres major and teres minor on the lateral side of the scapula? So if this is the scapula, I'm actually attaching on the border. And then I put the arm more backward, the shoulder more backward. I can do this mobilization.
Do you actually press on it as well?
A little bit pressure. When I come up, I release. Now I put the shoulder back into its place because a lot of the shoulders, you know, is forward. So I try to do the opposite and put the shoulder a little bit backward. But you know, nothing restricts me to work on the ribs. We did it when we did the abdomen. And if you are really limby, even on the hip. So you can do a really nice stretch, maybe here, you know, QL, and you're stretching the whole side of the body.
Don't do the hip thing on pregnant women, though,
Yep,
because it can cause
contraction.
no, it's gone out of my head. I'll tell you in a minute.
Okay?
Dilation.
Then let's do mobilization from below. Do you remember that mobilization? We've done that?
Pubis symphysis disorder.
Do you remember that one? Have we done it? Facing up? We did
Yeah.
no,
Wait, I think we did.
we did something similar.
Yeah.
Yeah? Good.
Which one feels the best for you, Rachel?
I think this one.
Why? Looks the funniest.
More secure, maybe?
Your hand looks a bit lost.
Yeah, your hands.
They look, it's relaxed, isn't it?
Yeah, it's not bothering me.
I would say your handling and your body position is the most important here. Yeah? Okay. Then let's start with the massage itself. Take this one down.
Yep.
Yeah, thank you. I would work first on the neck and shoulder. I would come from above. I can work on the deltoid. Nice effleurage to start with. You can come from here. I like it very much for the neck because it's almost like my fingers fall onto the erector spinae. Now, if you've seen that I don't have my head suspended here, but it almost like resting on the jaw a little bit, yeah, because it feels for me a lot more comfortable. Just how's the pressure?
Good.
From here, you can continue slowly upward, work on the upper cervical, suboccipital area. You can even continue and do some deep work around the ear, on the back of the ear. It's funny because you think, what I'm going to find there? There is no muscles, but it's quite tense. Work on the scalp, even on temporalis muscle. Coming a little bit down, working on the upper trapezius. Yeah. Even taking the shoulder a little bit forward and working on the area that usually would be covered by the scapula. So I'm actually bringing the scapula a little bit more forward and then work on all the ribs here. Then start working on the erector spinae from here. So actually glide downward to work as opposed to that position all the time. Okay. Bring the shoulder, bring the elbow back into here. Coming from above, you can now drape the fall back. Can I undo the bra?
Mm-hmm.
And then you can start working on the back itself. Now, you have to be a bit careful and stabilize with one hand on the shoulder. You can do a little bit of back mobilization. Do you see what I'm doing? I'm looking for the springiness. And some people that are really kyphotic, can you make yourself a little bit more kyphotic? Mm-hmm. Yeah. So then you can actually stabilize the back this way.
So what are you pressing on with your palm?
On the muscles, on the side.
Alongside the spine?
Yeah, if you press on the bone itself, as long as you're careful and not overly doing it, that should be fine. Yeah. But really what you're looking for is, and that's quite nice, is working on the edge of the vertebra and the muscle. So what I'm doing, you know the spine, if this would be vertebra, I'm looking for the attachment of the muscles into here, and I just slightly push it down. Not on the neck, but on the spine. If it's too much, you can do it with a knuckle. Good. I feel when I go into that area, the muscles are very responsive. Have you looked at these twitches?
Yes.
Yeah. So that means slow down, relax, and I have to do now more warm up. But a good indication to what happens. I can't work super fast now. I have to slow down. Okay. How about the shoulder muscles? Yeah. Infraspinatus and the teres muscles. You can come from here, work on the side. And it's always nice to combine it with a little bit of mobilization lullaby. Yeah.
Is there a limit to the pressure you can apply to someone who's pregnant?
Definitely, yeah.
On their back?
I would say, yeah. The lower you go, the more dangerous this is because the ligaments are quite lax at that time. Yeah? One great technique here is to work on the quadratus lumbarum. Yeah? And to work on the quadratus lumbarum, you have to imagine it being deeper to the more superficial muscle. Which one will be more superficial? Erectus spinae. So instead of coming from that side, you could come for a little bit on the side in here. And then let go. And then again. And let go. To make it even better, you change your hands, putting the other hand in here, and then you're pushing the hip upward. What happens to this muscle if you push the hip upward?
Relaxing.
It relaxes. Do you see that? Because the muscle attached to from here to here. If you're pushing that bit, you're actually making the origin and insertion a bit closer, and the muscle will be a bit more relaxed, lax, yeah? So,
And don't do this on someone who's pregnant either. Right, Joel?
yep. So, again, thumb, or you can put your fingers here. Yeah, I'll just show it to you. It's quite a small space. You're looking for the lowest rib and the iliac crest. So that would be the only place you could work. Yeah, but this is it, yeah? Work on the spine from here. Yeah. I like really to work down with the base of my wrist down on the muscle. Enough, isn't it? Yeah, plenty.
And then
So,
would you just turn them over and do the other side?
yeah. And then you can turn them over and do the other side.